Nurse Allen coming to you today with another video. I've done this video before, but I did it in two parts. I wanted to do it all together so you can kind of get a feel of how it looks. I'm going to be doing catheter care for a female resident. This is one of your 17 testable skills that you have to do, and it may be one of the skills that you have to test on. So one of the first things you're going to do is gather your supplies, and it's going to look a little something like this. I'm going to knock on the door. Good afternoon, Miss Allen. My name is Tanita. I'll be your CNA. I'm here to do your catheter care. Is it okay? The patient has given me permission to come in and do her care. The first thing I'm going to do is my hand hygiene until my hands are completely dry. Okay, Miss Allen, I'm just going to provide you some privacy. I'll be right back to go get my supplies. So I'm going to borrow Miss Allen's table, and I'm going to go gather my supplies. Now, depending on where you go, where you're at, some places use a Chuck's pad, a towel, paper towel, but you have to have a barrier on the table. So when you're doing this skill, I want you to have a barrier on the table. At my facility, I use this as my barrier. So here's my barrier for the table, but mind you, you can use paper towel, Chuck's pad, another bath towel, long as you have a barrier on the table. So what do we need for catheter care? The proctor's going to read, the proctor's going to read in you a scenario that you do not have to put a pad up under the patient. So that's one thing you don't have to get. So you need a cover-up blanket for the patient. So you're going to need a bath blanket to cover the patient up, a dry towel to dry off the catheter. You're going to need 2 face towels, one to wash, one to dry. So these are the things you're going to need here. You need some soap. And you need your wash basin. These are the things you need here. And then you need a pair of gloves. So this is the things that you need for this particular skill. You need 2 bath towels, 2 washcloths, soap, gloves, and your wash basin. So I'm going to bring this over here towards the sink. And I'm going to grab my paper towel to turn on the water. I'm going to fill my water to the 2 line. You don't need a lot of water. You just need it to be to the 2 line. Just enough water to clean it. I'm going to make sure it's the temperature. Once I got my water, I'm going to sit it down. I'm going to grab another paper towel to turn off the water and discard that. So now I'm going to go to my patient with my water. Miss Allen, can you check the temperature of the water? Miss Allen says the temperature is okay. So at that time of my bed, I would check my bed for safety. Make sure that the wheels are locked all around the bed. The bed is not moving. It's not. It's at the highest position. Miss Allen, I'm just going to move your call light out of the way. So I'm going to take and put a warming barrier over Miss Allen. So the first thing I'm going to do is cover Miss Allen up with a warming blanket. So I'm going to put the blanket over Miss Allen. I'm going to fan fold this down, only exposing what I'm going to wash. So I'm going to wash this, and I'm going to pull this down up under the cover. So now I'm only exposing the catheter because that's what the skill calls for me to do catheter care. So I'm just going to expose Miss Allen just enough that you can do the catheter care. So now I'm going to put on my gloves. Oh, that one broke. Let me grab another one. Now that I have my gloves, I probably should turn this around, like so. Now I'm going to take my towel, submerge it in the water, squeezing out any excess water. Then I'm going to open up my towel and apply my soap all around so I get it all up on there. I'm going to lather my towel up, getting all the areas so the soap is everywhere. I'm going to fold my towel back up in folds. I call it the bouquet method. So when you're looking at your towel, you're holding it like a bouquet. So now I have areas to clean my patient. So Miss Allen, I'm going to clean your catheter. I'm going to fold the other ones back. I'm going to use my 2 fingers so that I can curl it around the whole catheter. So I'm going to grab it at the tip of the meatus, and then I'm going to take my towel and go 3 to 4 inches down. And you're going to tell your proctor without tugging, I washed it once. I'm going to pull my towel back. I'm going to grab my 2 fingers out and hold it again. Hold it at the meatus. And I'm going to wipe down 3 to 4 inches, letting my proctor know. I'm going to take another set of my towel. I'm going to hold it again. Hold it. So I'm holding the whole line, and I'm wiping 3 to 4 inches down again without pulling. Whatever you wash, you must rinse. So I'm going to sit that towel down. I'm going to grab another towel, rinse that towel out, squeeze all the water, make sure it's folded so that I got good coverage on my hand. Making my bouquet method again. I'm going to fold all the other ones back. I'm going to hold at the tip again, at the tip of the catheter, at the meatus, and I'm going to grab the catheter and I'm going to wipe 3 to 4 inches down. Wiped it once. Going to grab it again at the meatus. Wipe it twice, all the way down 3 to 4 inches. My last wipe, I'm going to hold it again, holding at the tip of the meatus, wiping down 3 to 4 inches, all the way down. Whatever I wash, I rinse, I now must dry. I'm going to take my towel and pat dry the catheter. Now that I've dried the catheter, I'm going to take and pull Miss Allen's gown back down. Again, I'm not touching Miss Allen. Now I'm going to take the inside of my blanket, my towel that I'm using as a warming blanket, and I'm just going to pull the cover back up over Miss Allen. Not touching her covers, not touching anything. Now I'm going to discard my towels. So now that I got Miss Allen covered up, I'm going to go discard all my towels into the dirty linen. So I'm going to take and move everything and go put this in the dirty linen. Pour this in the dirty linen. Put that away. Now the only things I have to get rid of is my water. So I'm going to grab my water. I'm going to pour it in the sink. I'm going to grab a paper towel, turn on the water, throw that into the garbage, rinse out my basin 3 times. Once, twice, 3 times. I'm going to sit it on the counter. I'm going to grab a fresh piece of paper towel to hold it so that my gloves are contaminated, so I don't want to touch that. So I'm going to take another piece of paper towel. I'm going to clean the inside. I'm going to discard that. I'm going to dry the outside. Discard that. I'm going to grab another one. Turn off the water. Discard that. I'm going to grab my new piece of paper towel and I'm going to pick up my soap, put it in my wash basin, and I am going to put it in the patient's drawer. Now that I've put all my supplies away, I'm going to discard this into the dirty trash can. The only thing I have left to do is get rid of my barrier. Now, some people can use a Chuck's pad and just discard everything. It's your choice. It's no wrong way, but long as you have a barrier. So some people choose to just use a paper, so it's easier to discard everything. So it's not really a big deal. If you don't use a cloth barrier, you can use paper towel, long as you have a barrier. I've discarded that into the dirty linen. Now I have to remove my gloves. So I'm going to pinch my gloves in the middle, ball that up, discard them into the trash. I sanitized before I started, so now I can touch everything and go fix Miss Allen up. So I'm going to bring my table back to the side. And I'm just going to make sure Miss Allen is nice and neat in her bed. Miss Allen, you okay? Okay, I'm going to make sure she's okay. I'm going to give Miss Allen her call light back. I'm going to open up my privacy curtain. I'm going to lower my bed back down to a working height. Now the skill says that I have to go wash my hands. This is a skill that you have to wash your hands. So I'm going to go back over to the sink and I'm going to grab a paper towel, turn on the water, discard that paper towel. I'm going to wet my hands, all surfaces of my hands, wetting it. I'm going to apply soap. I'm going to wash my hands vigorously for 20 seconds. You want to wash, rub between the fingers, all of them your fingertips, singing happy birthday, ABCs to yourself. You want to get up under your fingernails. And you should be doing at least 10 seconds each finger. Making sure you got all those surfaces. Once you've washed them for your 20 seconds, you're going to rinse your hands, all that agent off of your hands. You're not going to flick. You're going to hold your hands down in the water like so. You're going to grab another paper towel, clean, dry your hands. You're going to discard that. Then you're going to take your last one after you've dried your hands and turn off the water. Then you're going to step back, look at your environment. Miss Allen, you need anything? Some water, a magazine, anything like that? Miss Allen says she doesn't need anything. You'll think about all the steps of your skill to make sure that you did not miss anything. You knocked on the door, you announced yourself, you let the patient know what you were doing, you provided the patient privacy, you checked the bed for safety, you let the bed up, you let the bed down, you've opened up your privacy curtain. What was the skill? The skill was catheter care. I washed the line, holding at the tip of the meatus, and I wiped 3 to 4 inches 3 times. I rinsed 3 times. I dried it. Once you do that, then you can say, I did everything. Then you make sure, did I not cross-contaminate? I had paper towel in my hands when I was putting her things away. And then after I went through it 3 times, I'm going to triple check myself to make sure I've done everything. Then I will tell my proctor, my skill is complete. Please click like, subscribe, and share. I will be bringing videos to you on a regular basis, and I will see you soon. Have a nice one.